And now the topic of discussion is anterior abdominal wall. Now we're talking about the anterior abdominal wall. Now exactly what is the thing that we will be discussing in anterior abdominal wall? So the thing that we'll be discussing here in this topic is we'll be talking about the anterior portion and also about the side of the abdomen. That means we'll be talking about the anterior lateral compartment of our abdomen. So the heading anterior abdominal wall usually includes what? It includes the front as well as the side of abdomen, right? And so it can be more precisely can be said as anterior lateral abdominal wall. So now before jumping into the topic directly, the thing that we need to discuss here is we will talk about some of the surface marking. So some of the surface landmark. Okay, we'll be talking about some of the surface landmarks, right? And on the surface landmark, the thing, okay, the anterior abdominal wall, right? Anterior abdominal wall, it will begin or it will extend from what? From gyphoid process. As you can see right here, gyphoid process, this structure, it will begin from gyphoid process, this structure, right? Okay, gyphoid process. Now what is the location of gyphoid process? The location of gyphoid process, if we see the location of gyphoid process, we will find that its location is in 9th thoracic vertebra. What? 9th thoracic vertebra, that means in the position of T9, right? Okay, okay. Okay, now from this region, from this gyphoid process that is lying at the T9 level, from here to pubic symphysis, that means from here. Okay, now this is the location where the anterior abdominal wall extends. That means it extends from what? It extends from gyphoid process to what? Pubic symphysis, right? Pubic symphysis. Okay. now okay, if we see this pubic symphysis, it will lie at the level of what? Tip of coccix, right? It will lie at the level of tip of coccix. So right now the thing that we need to get concerned right now is it extends, I mean our what? Anterior abdominal wall extends from what? Gyphoid process to pubic symphysis. This pubic symphysis lies at the level of tip of coccix, right? This is it. Now another thing that we need to know, that we need to concern right here is, okay, we talked about what? We talked about superior and inferior points at which the anterior abdominal wall extends. Now let us talk about other things, right? We'll talk about superior lateral margin. Talking about superior lateral margin, I mean from laterally, what is the lateral area till which we will consider or we will study on this anterior abdominal wall, right? Okay, now talking about superior lateral margins, we will find that there are what? There are costal margins, as you can see right here, costal margins, and these costal margins, these denote the superior lateral margin of what? Anterior abdominal walls, right? Okay, this is it. Now talking more, okay, we will talk more about these things. Now there are other things that we need to know right here, and the other thing are okay, if you will see clearly in this figure, right, we talked about gyphoid process, uppermost border. We talked about what? Tip of coccix, which is at the level of what? Pubic symphysis, right? And similarly here we will find what? We will find the lower border of L1 lumbar, first lumbar vertebrae, right? And upper border of L3, right? If you remember, or if you just okay, let us move forward. We can see here vertebra L5 level, and here in the center we will find what? Umbilicus, right? And we studied in earlier, I mean in abdominal plane, that the umbilicus lies at what? L3, between L3 and L4 level. I mean between L3 and L4 level there is the presence of umbilicus, right? And similarly here is the mentioning of subcostal plane. If you remember subcostal plane, right? Subcostal plane, it lies or anteriorly it has the border, or it lies at the level of what? It lies at the costal cartilage of it lies at the costal cartilage at what? At 10th rib, right? At 10th rib. at the 10th rib. And subcostal plane, we discussed subcostal plane. Well, we were discussing about what? Transpyloric plane, right? And we discussed there that transpyloric plane, it was lying at the level of what? 9th rib. So this is what? Subcostal plane, right? And here you can see this is what? Transpyloric plane at what? At the level of 9th rib. And costal margin we already discussed, right? Costal margins, right? Costal margins are the structures that denotes costal cartilage. And here transtubercular plane, if you remember transtubercular plane, what is transtubercular plane? The plane that passes through what? Tubercle of iliac crest, right? Tubercle of iliac crest, right here you can see here it is what? Tubercle of, this is iliac crest, this is structure, and here this one is transtubercular plane, right? Another thing that we need to know here is linea semilunaris, right? Linea semilunaris is the lateral boundary of what? Lateral boundary of rectus seed. We'll learn it in detail afterwards, but right now we need to know that linea sublunaris is the lateral boundary of what? Rectal seed. Similarly, there is one central linea alba that we will discuss later on, that will pass through our umbilicus. So these are the things, landmark of abdomen, that we need to know. Okay, moving forward. Yes, this is okay. Here you can see, right here you can see linea alba, right? Linea alba, it passes from what? Gymphoid process to pubic symphysis, right? It is the it is the central, I mean it divides rectus seed into two equal halves, right? Linea alba, and this alba means white. This alba means white. It is simply a white line like structure that passes through what? Through umbilicus. And as we discussed earlier, linea semilunaris, it denotes the lateral boundary of what? Lateral boundary of rectus seed. Okay, that's all. And umbilicus, we discussed it earlier. Umbilicus is right here, tip of 9th costal cartilage. And if you remember, from the tip of from 9th costal cartilage, there was one lying plane that was passing, and that was what? Transpyloric plane. Transpyloric plane, right? Okay, that's all. Now costal margin. Yes, costal margin are the margins made by costal cartilage. That's all. Inguinal ligament. Now what is this inguinal ligament? Inguinal ligament, there is ligament that arise from what? Anterior superior iliac crest, and it get inserted into what? Pubic what? Tubercle, right? Pubic tubercle. Now this structure is inguinal ligament. So it is inguinal ligament, and here it is shown testis, it is shown anterior superior iliac spine. This is gymphoid process. Where it lies? Gymphoid process at what? Thoracic 9th vertebrae level, right? Okay, this was all about what? This was all about the surface marking, right? Surface marking. Now we will move forward, and while moving forward, now initially okay, anterior abdominal wall. Okay, let us move toward this diagram. So these are the layer, right? These are the layers on what? Anterior abdominal wall. These are the layers. Now outermost layer is our skin, right? This is our skin. This is the outermost layer. Now inside skin, what we will find there? We will find superficial fascia. What we will find? We will find superficial fascia. Okay, just concentrate right here. We will find superficial fascia. Okay, right? Outermost is our what? Outermost is our skin, right? And under skin, what we will find? We will find superficial fascia. Now this superficial fascia is further divided into two types. Okay, I'm going to highlight it, right? What is this? Okay, superficial fascia, right? There are what? Superficial fascia under skin. Now this superficial fascia, right? The outer one is the fatty superficial fascia. Okay, fatty layer of superficial fascia, and it is also known as Camper's fascia. What I said is Camper's fascia. This outer one is the fatty superficial layer of superficial fascia is what? Camper's fascia. So, and deeper to this Camper's fascia, we have got what? Membranous layer of membranous layer of what? Superficial fascia. What I'm saying is, inside it we get what? Membranous or deep layer of superficial fascia, and it is known as what? Scarp's fascia. What it is called? Scarp's fascia. So we need to know C and S, Camper's fascia and Scarp's fascia. So that's all. So we talked about skin, right? Inside skin, what do we have got? We have got fatty layer of superficial fascia, and that is what? Camper's fascia. And inside Camper's fascia, what do we got? We got what? We got another membranous fascia of superficial fascia, and that is what? That is Scarp's fascia. Scarp's, Camper's and Scarp's. Okay, now since we talked about skin and superficial fascia, we'll move forward, and there are now muscles, right? Now talking about muscles, the outermost muscle is external oblique muscle. What is the outermost? External oblique muscle, that you can see right here. This is what? External oblique muscle. And moving inward, we'll find what? We'll find internal oblique muscles. What will we find? Internal oblique muscle. Similarly, again moving forward, we'll find transverse abdominal muscles. Transverse abdominal muscles, right? Now inside transverse abdominal muscles, what we will find? Inside transverse abdominal muscle, we will find transversalis fascia. What will we find? Transversalis fascia, right? Now inside transversalis fascia, what we are going to find is endo-abdominal or extraperitoneal fat right here, right? Extraperitoneal fat, and under extraperitoneal fat we will find parietal peritoneum. So let us move from outside to inside. So outermost, what is the outermost? The outermost is skin, and inside skin, what we will find? We will find superficial fascia. Okay, superficial fascia, it is of two type, right? The outer one, the fatty layer of superficial fascia, which is also known as Camper's fascia. Now inside of that we'll get what? Membranous fascia, membranous layer of superficial fascia, and it is also known as what? Scarp's fascia. What? Scarp's fascia. So now inside Scarp's fascia, what we'll get? We'll get now muscles. What is the outermost muscles called? It is called external oblique muscle, and inside of external oblique muscle we'll get what? We will get internal oblique muscle, and inside of internal oblique muscle we'll get transverse abdominal muscle. Transverse abdominal muscle, and inside transverse abdominal muscle we'll get transversalis fascia, right? Fascia. Now we'll get what? Fat. What is that fat? Extraperitoneal fat, and then inside of that extraperitoneal fat we'll get parietal peritoneum. So this was all about what? This was all about the layers that are found on anterior abdominal wall. Now okay, this is again the same diagram. The outermost thing that we talked is skin, right? This is the skin. Now inside skin, what we will get? We'll get superficial fascia, and under superficial fascia, the fatty layer of superficial fascia, Camper's fascia, right? Camper's fascia, we can see it right here. And inside that Camper's fascia, what we'll get? We'll get superficial fascia of what? Membranous layer. Superficial fascia of membranous layer. And what it is called? It is called what? Scarp's fascia. Scarp's fascia. Camper's fascia and then Scarp's fascia. So we reached right here, right? Now inside that we'll get what? Muscles. Now what are the muscles? External oblique muscle, internal oblique muscle, transversus abdominis muscles, right? And then transversalis fascia. Now inside of that we'll get what? Extraperitoneal fascia, right? Extraperitoneal fat, that consists of extraperitoneal fat, and inside of that we'll get parietal peritoneum. So this was all about what? This was all about the layer that we'll find in anterior abdominal wall, right? Now we'll move toward a bit deeper topic, right? Okay. now okay, take a deep breath. Now we are going to talk about something a bit interesting. Okay, now this is the diagram. Okay, here you can see this is what? This is 3-month fetus, right? 3-month fetus. Now what is happening right here in this 3-month fetus? In this 3-month fetus, this scrotum, right here you can see, sorry, this is our testes. What is this? Testes. Now what is this testes? Now here you can see the direction. Now what is this direction showing? This direction is showing that this testis is being taken to what? This is being taken to what? Scrotum, right? Scrotum. Okay, now okay, when testis is descending down, when this testis is descending down, it will bring some of the what? Anterior abdominal wall layer into scrotum. Okay, now this is what, this is testis. Now it is going to get into scrotum. Now when it is going to get into scrotum, what it will do is it will just pull, or it will take, right? It will, when it is descending into scrotum, it will, what it will do is it will bring some of the peritoneum of abdomen with it into scrotum, right? Into scrotum. Now okay, now what will happen is there will be, okay, during this time there will be the formation of this cavity, right? Cavity. Okay, this cavity, what is this cavity called? This cavity is called, what is this cavity is called? This cavity is called peritoneal cavity, right? Peritoneal cavity. What I said is this is called peritoneal cavity. Now why this is called peritoneal cavity? Because simply it is lined by what? It is lined by peritoneum, right? You can see this is lined by peritoneum. Okay, when testis is descending down, okay, again I am repeating it, when testis is descending down, right, it will carry double fold of peritoneum. Now what it will do is it will carry, this testis will carry double fold of peritoneum, right? double fold of peritoneum, and this will be called as transverse vaginitis. Okay, this will be called as transverse vaginitis. So we'll be clear about that thing later on. Okay, now focus right here. Now this testis is being brought down, and this is being brought down with the help of what? With the help of gubernaculum. Okay, gubernaculum pulls testis toward the base of scrotum. This will pull the testis toward the base of scrotum. During this, small cavity along with vaginal pore will follow. Now when it is pulling testis downward, there will be the formation of what? Cavity, and that's peritoneal cavity, and along with peritoneal cavity there will be the formation of process. Now what is this lower one? What is there will be the formation of process. Now what is this lower one process called? This lower one process will be called what? Vaginal process. Okay, right? Vaginal process. Now what is going on? Okay, now this vaginal pore, if you will see, this was the figure of 3-month fetus. Now we'll be moving toward 8-month fetus. Now in this 8-month fetus, what will happen is, here you can see this vaginal process, right? You can see here prominent vaginal process, right? Now testis is on its way. Testis is on its way to reach scrotum, right? Testis coming toward scrotum, pulled by gubernaculum, right, on the base of scrotum. Now this will form transverse vaginalis. What I said is transverse vaginalis, right? Okay, transverse vaginalis. This is what? This is our vaginal process. Okay, now okay, now in 1 month old infant, right, this is what? This was 8-month fetus. Now the child is already born, right? It is already born. Now what will happen in 1 month old infant? What will happen is this peritoneum, which was continued, right? It was in what? In 8-month fetus. In 8-month fetus, this peritoneum was continued, right? There was the formation of what? Vaginal process. This was continued. But now what will happen is this peritoneum will be discontinued, right? Now what will happen? Closed proximal portion of vaginal process. Now what will happen? This vaginal process will be closed. Now why it is closed? Because if it won't be closed, then what will happen, right? What will happen? There will be continuation between peritoneal cavity and what? Peritoneal cavity and inguinal region, right? Inguinal region. Now this will result in what? Hernias. This will result in hernias. This will result in what? Hernias. So this is needed to be closed. So now if you focus right here, right, because of closure of our what? Vaginal process, there will be formation of double layer peritoneum structure right here, and that is tunica vaginalis, right? What will happen here? Right, you can see right here it was continued, right? It was continued earlier, but now what is happening right now? Right now this structure and this structure is being closed, right? And upper one structure, this above structure, what is this? Abdominal cavity. And now here there is one structure forming, by the double layer of peritoneum, and this structure is called tunica vaginalis. Now what this structure will do, this will cover testis, right? You can see right here testis is being covered by what? Tunica vaginalis. Okay. Okay, now let me again say you, right? As testis is pulled by cavernaculum, a small part of peritoneal cavity follows the testis toward the scrotum, right? What I said is, again, same thing. As testis is being pulled by cavernaculum, a small part of peritoneal cavity, as you can see right here, follows the testis toward the scrotum. And what is this small part of peritoneal cavity, right? It was what? Vaginal process. The process vaginalis or vaginal process, right, forms tunica vaginalis. Okay, what this vaginal process will form? It will form tunica vaginalis. You can see it is this tunica vaginalis. It is formed because of vaginal process, right? How it was formed by vaginal process? By closing its opening, right? The closing of the opening of what? Vaginal process is closed, and this vaginal process will give rise to what? This will give rise to tunica vaginalis. That's all, right? And now what? This vaginal process will be obliterated, right? This will disappear. This vaginal process will be disappeared, right? Well, descending testis bring okay, well descending. Now what is happening when this testis when this testis is descending downward? It will bring what? It will bring peritoneum to the scrotum. As you can see, this blue line, right? This line, this was above, right? This was above, not in scrotum. Look, this well descending, this came down, right? Here you can see that testis has brought what? This peritoneum into scrotum. It has brought peritoneum into scrotum. Okay, now the thing that we need to know right here is why we are discussing this thing. We are discussing this thing because the anterior wall, the layer in anterior wall of abdomen, they are contributing to various structures in this structure, in scrotum. So what are the different structures that we will be discussing right now? Okay, now for clarification, okay, I would like to draw one structure, right? Okay, I would like to draw one structure, and the structure is, this is what? This is our peritoneum. What is this? This is our, okay, this is our peritoneum, right? This is our peritoneum. Now peritoneum. Now outermost layer, okay, outermost layer of anterior abdominal wall is what? The outermost layer is what? Outermost layer is skin, right? The outermost layer is skin. So this is skin, right? The outermost layer is skin. Now what will happen is, when testis is being brought down, now this will cause this skin of abdominal layer, right? It will bring with it, and it will now we can say that it is what? It is our testis, right? It is testis. Now these testis, right, the skin superficial or skin, the outermost structure in anterior abdominal wall, this skin will form what? This skin will form scrotum, right? Skin of scrotum, scrotum of testis. Similarly, inside skin, what we have? Inside skin we have superficial fascia. As we talked, there are two parts of it. The one is the fatty layer, right? Another is what? The membranous layer. Okay, now inside this, what we have is, we have superficial fascia. Okay, this is our superficial fascia. Now what will happen is, this superficial fascia, it will be descending down with testis, as the skin was descending down, right? Now as it was superficial fascia, right? Superficial fascia, what it will form, right? It will form dartos. What it will form is, it will form dartos. Now what is this dartos? It is a structure just in testis. What it will form is, it will form dartos. Okay, dartos. What is this dartos? Dartos is subcutaneous muscle of scrotum, right? Now it is what? It is subcutaneous muscle of what? It is subcutaneous muscle of scrotum, right? Now it is dartos. It is lying where? Deep to skin, right? Okay, now Now the thing that we need to know is, what is dartos? Dartos is superficial muscle of scrotum. It is formed by what? Descending down of superficial fascia. That's all. Now another thing that we need to know is, okay, another structure. Now deep to superficial fascia, what we have got? We have got external oblique muscle. What do we have got? We have got external oblique muscle. So this is what? This is external oblique muscle. Now what this external oblique muscle will contribute in our this testis area? What it will do is, this external oblique muscle will form, what this will form? This will form external spermatic fascia. What? External spermatic fascia. Okay, external spermatic fascia. Now inside external oblique muscle, what do we have got? Inside external oblique muscle, what we have got is, we have got internal oblique muscle, right? This is what? This is internal oblique muscle. Now talking about this internal oblique muscle, right, what it will contribute, right, what it will contribute in our this testis area? What it will do is, it will form, what it will form? This internal oblique muscle will form cremaster fascia. What it will form? It will form cremaster fascia. Fascia, right? Cremaster fascia. Now talking about the cremaster fascia, right? Now inside of this is what? This is our internal oblique muscle, right? Internal oblique muscle. Now inside of internal oblique muscle, what we have got? The thing that we have got inside of internal oblique muscle is, we have got what? We have got transversalis abdominis, right? We have got what? Transversalis abdominis, right? Now what will happen is, this transversalis abdominis, right, it will not contribute anything, right? It will be stopped right here only, right? Transversalis abdominis will be stopped right here only. Now deep to transversalis abdominis, what we have got? Deep to transversalis abdominis, we have got another structure, and that structure is what? That structure is transversalis fascia. What we have got? We have got transversalis fascia. Now what this transversalis fascia will contribute to? This transversalis fascia will contribute to what? This will contribute to internal what? Internal spermatic fascia. Okay, as you can see, what? External oblique muscle was what it was doing? External oblique muscle was contributing to what? External oblique muscle was contributing to external spermatic fascia. Similarly, what? Another what? Transversalis fascia, what it is doing? It is contributing to, this is what our, this is transversalis fascia. What is transversalis fascia is doing? It is contributing to form what? Internal spermatic fascia. That's all, right? Okay, now peritoneum. This is our what? This is our peritoneum. Okay, what is the main motto, right? That means what we need to remember is, we need to remember that when testis is being when testis is descending down with the help of gubernaculum, what it will do is, it will take peritoneum, right? It will take some of the layer of anterior abdomen wall with it into scrotum, and it will and these structures will help in forming different layer, right? Different layer around testis, such as skin. What it is doing? It is forming scrotum, skin of scrotum. What is superficial fascia doing? It is forming what? It is forming dartos muscle, right? Dartos muscle. What is external oblique muscle doing? External oblique muscle, it is forming what? External spermatic fascia. Similarly, internal oblique muscle, what it is doing? Internal oblique muscle is doing what? It is forming cremaster fascia. What it is doing? It is doing cremaster fascia. Similarly, transversalis abdominis, it will not contribute at all, right? It will be stopped at that place. Now what about transversalis fascia? Transversalis fascia, it will help in formation of what? Internal spermatic fascia. So this was all about what? This was all about anterior abdominal wall that was playing a role in these our inguinal region when testis is being down, right? Okay, that's all. Now the next thing that we need to discuss is, okay, we discussed about this thing also, right? Okay, we discussed about this thing. Now another thing that we need to discuss is we need to discuss about rectus sheath. Now we need to discuss about rectus sheath. Now what is rectus sheath? Okay, understanding the rectus sheath, its name is rectus sheath. Okay, let me write here title right here. The title is rectus sheath. Now why the name rectus sheath? The name is rectus sheath because it covers what? This sheath, right? Sheath means covering. It covers what? Rectus abdominis muscle, right? It covers rectus abdominis muscle. Right here you can see what? This is our rectus abdominis, right? These pack like structure. Okay, let me show you. These pack like structure. What? 1, 2, 3, right? And here also we have 1, 2, 3. Okay, these are what? These are rectus abdominis muscle. Okay, rectus abdominis muscle. Now what is rectus sheath? Rectus sheath is simply the covering above these rectus abdominis muscle. That's all, right? Okay, in this figure, as you can see in this figure, what is going on is here the white portion, as you can see, this white portion. Okay, this white portion, as you can see, yes, this is what? This is rectus sheath. What is this? This is rectus sheath, right? And when this rectus sheath is removed, then we are able to see what? Rectus abdominis. So these are rectus abdominis. Now what is its important? Okay, now what are the things that we need to know right here? Okay, now the thing that we need to know right here is we need to know about linea alba. We have discussed this earlier, right? Linea alba. So this line, this white line, right? You can see the prominent white line right here. You can see, right? Okay, this white line is called what? Okay, sorry, this white line is called linea alba. As you can see, okay, it's not mentioned here. Okay, it's all right. This white line is called linea alba. What I'm saying is L-I-N-E-A, linea, A-L-B-A, alba. What does alba means? It means white. So it is white line. You can see this is what? This is white line. So, and talking precisely, this linea alba, what is it? Is a midline. Simply, it is a midline, right? It is the midline. It is the midline that divides rectus abdominis muscles into right and left, right? It is a midline, and it is more prominent, right? This linea alba is more prominent in upper region, as you can see right here, right? This upper region, it is showing a bit thicker, and these are a bit prominent in upper region than in lower region. Okay, now this is alba means white, so this is white in color. That's all, right? Okay, now we talked about linea alba, right? And another thing that we need to know is if you just look it properly, you will find same like of linea alba. You will find in this corner, you will find white structure, right? White border like thing right here, right? These. Now what are these things? These are linea semilunaris. We discussed about this thing earlier, right? What are these? These are linea semilunaris. As you can see, linea semilunaris, right? These are linea semilunaris. Now what these linea semilunaris do is, these are the lateral boundary of what? Rectus sheath. We discussed it earlier, right? In surface marking, right? In landmarks of abdominal wall. So these are what? Linea semilunaris. Okay, what is its important? Its important is that it is present in lateral border of where? In lateral border of rectus abdominis, right? Lateral border of rectus abdominis. Now okay, we talked about linea alba right here. Yes, linea alba. We talked about linea semilunaris. Yes, we talked about linea semilunaris. Okay, now let us talk about these intersections, right? These intersections, white intersections. Okay, in bodybuilders, what we see is we see packs. Why we see packs? Six packs. Why we see six packs? We see six pack because the rectus abdominis muscles, they are intersected by, okay, you can see right here, they are intersected by what? Tendinous intersections. Okay, if you just do more workout, if you just go to gym and work so hard, you will what it will do is, the tendinous intersection will be what? It will be seen, and tendinous intersection that causes the appearance of what? Six packs, right? Okay, so so tendinous interaction between rectus abdominis muscles, right? This is one rectus abdominis, this is another rectus abdominis muscles. Between the rectus abdominis muscles, okay, between rectus abdominis muscles, there will be the appearance of packs. Now these packs are because of what? Tendinous intersection. That's all, tendinous intersection. Okay, now another thing that we need to know here is, we need to know about okay, tendinous intersection we talked. Okay, when we just remove the rectus abdominis muscle, as we can see right here, if we remove rectus abdominis muscle, what we will see is, we will see external oblique muscle, the outermost muscle, right? External oblique muscle. Similarly, inside of external oblique muscle, we will see what? Internal oblique muscle, right? Inside of okay, internal oblique muscle, what we will see? We will see transverse abdominis muscles. It's not shown here, shown right here. So that is what rectus sheath, right? This is what the rectus sheath is. Okay, what we are missing right now? Okay, now, okay, the important thing that we need to talk here is, we'll talk about rectus sheath, right? Rectus sheath in detail. Okay, now another diagram. Okay, let me draw myself if it is not mentioned here. Okay, now what will happen is the rectus sheath, right, in different places. Okay, I mean abdomen. Okay, anterior wall of abdomen, we just said that it will begin from where? It will begin from this xiphoid process to what? Pubic symphysis. So from here to here, there are different places in which the rectus sheath will be contributed by, I mean, different muscles, right? They are not similar. I mean, there are three positions in which we will talk about the rectus sheath, right? We'll talk about the rectus sheath, such as the first position that we will be talking about is, we'll be talking about above the costal margin, right? Above the costal margin, how how rectus sheath will be formed, right? Now above arcuate line, if you don't know what arcuate line is, it should have shown right here in surface marking. Okay, no need to worry, we'll just watch it later on. Okay, now what I'm saying is, now we are going to talk about abdominal wall muscle and rectus sheath, in different positions. Above costal margin, one will talk about above costal margin, and above arcuate line, okay, below arcuate line, and just above pubis. Okay, especially here we talked about four, right? We talk about four positions, but especially we'll talk about these places above what? Above costal margin, right? Above arcuate line, right? And the last one is what? Just above what? Pubis. We'll be talking about these things, right? Okay, now we're talking about this thing, just we'll take a transverse section of, okay, this is the human body, right? This is the human body. What we're doing is, we're taking the transverse section. We're taking transverse section at what? What we are taking? We're taking transverse section at what? Umbilical region. Now when okay, let us talk about this especially this one, right? Okay, this is the linea alba. As you can see, the lineal alba is what? It is the midline, right? Midline of rectus sheath. And what is this? This is what? This is our rectus abdominis. It is one muscle, and here also we'll find what? Another rectus abdominis muscle. Now what is going on here is, this rectus abdominis muscle, it is being covered by what? This external, okay, it is being contributed by external oblique muscle, right? You can see right here, it is being contributed by external oblique muscle. As you can see, external oblique muscle, it is external oblique muscle, it is just passing its aponeurosis right here, and it is covering the rectus abdominis anteriorly. And similarly, there is what? internal oblique muscle, it is also, now here what will happen is this internal oblique muscle will divide into anterior and posterior part, and it will just contribute to what, anterior wall and posterior both wall. Now what, external oblique muscle, it was just contributing to what, anterior wall, but internal oblique muscle, it is contributing to anterior wall as well as posterior wall. Similarly, what is this, transversalis abdominis. Now, and transversalis abdominis, what it is doing is it is contributing to posterior wall, right, posterior wall. Okay, now this was about what, this was about the region just in umbilical region. Now what about the region above costal margin? Above costal margin, what will happen is, above costal margin only external oblique muscle will contribute to what, anterior boundary, right, anterior boundary, right, and posteriorly there won't be what, there won't be internal oblique muscle and there won't be transversalis abdominis, there won't be this two structure. Instead, this rectus muscle, it will just sit, right, it will sit on the surface of what, on the surface of costal cartilage or ribs, right, it will sit on the costal cartilage of ribs. Now talking about the last case, in the last case what will happen is, this is what, this is rectus abdominis muscle, its anterior surface is contributed by what, it will be covered by the aponeurosis from what, external oblique muscle, aponeurosis from internal oblique muscle, right, here it will not divide into anterior and posterior, right, above in the umbilical region it was dividing, and the last one is transversalis abdominis. These all contribute to what, these all contribute to anterior surface of anterior surface in rectus muscle, and posteriorly what will happen is it will just sit on the surface of fascia transversalis, right, fascia transversalis. So it is also the same thing, right. Okay, you can see above the costal margin what will happen, external oblique muscle will only contribute to what, to, it will contribute to anterior surface, and this is the midline, or we can say what, we can say linea alba, right, and posteriorly only costal cartilage, right, you will just sit on the surface of costal cartilage. Okay, here in above arcuate line what will happen is, external oblique muscle was contributing on anterior surface, internal oblique muscle was divided into anterior and posterior and contributing to both the walls, right, and transverse abdominis, what it was doing is it was just contributing on posterior surface. And similarly, what is this transverse fascia, it is just lying on the posterior surface. Okay, and what is going on right here is, below arcuate line, external oblique, internal oblique, transverse abdominis, all these form what, anterior surface, all this covers the anterior surface, whereas transverse fascia, it will just contribute on the posterior surface. That's all, right. Now here it is also the similar case, right, not different than that. So this was all what, this was about the abdominal wall muscle and rectus sheath, right, rectus sheath. Okay, here it is the same figure, as you can see. What is this, this is this A figure, it is the, what is this A, this A denotes what, above the costal margin, right, above the costal margin external oblique muscle was forming anterior wall of rectus sheath, right, and similarly on this B, what is this B structure, between costal margin and arcuate line, right, this B region shows, what this B region shows, this, okay, yeah, right here you can see the arcuate line, right, this is the arcuate line. Now what is this B showing, this B is showing the region between what, costal cartilage and what, arcuate line. Now what will happen here is, in this B, the external oblique muscle will form what, anterior wall of rectus sheath, internal oblique muscle will contribute to anterior and posterior both wall of rectus sheath, and transversus abdominis will contribute to posterior wall of rectus sheath, and fascia transversalis will also lie on the posterior wall of rectus sheath. That's all. And what is this C structure showing? Now this C structure is showing the structure below arcuate line. Since this is the arcuate line, as you can see right here, this C structure, this much structure, it is the structure below the arcuate line. So what is the C structure showing? Okay, here both external oblique, internal oblique and transversus abdominis, these all contribute to what, anterior wall of rectus sheath, right, anterior wall of rectus sheath. And on the posterior wall we have got fascia transversalis. So this was about what? Abdominal muscle and rectus sheath. So if there is anything left, let me see, right? So this is all about rectus sheath and anterior abdominal wall. So what we did is, initially we talked about surface landmarks, right? We talked about the relation between anterior abdominal wall and scrotal linings. We talked about different layers. We talked about rectus sheath, right? We talked about rectus sheath and abdominal muscles, right? In the different region we talked how the surface of rectus sheath are being made. So this was all for this lecture. Thank you and have a great time.